Hello, friends. It's Tron Jordheim here, and today I'm working on my COVID calculator. Those of you who know me as an analyst and a numbers geek know that I love to create little spreadsheets to test assumptions and to see what I can come up with under different scenarios. So, if you've been paying halfway attention, you know there's all kinds of great charts and great data about the COVID-19 nonsense. And I'm trying to make something that's a simple visual for you to see what the impact in your community could be. And so let's look at that. So here's where you plug in your area population. I live in a small community, so that's 150,000 here. This first set of numbers is the percentage of people who get infected. Now, this is a very hard guess because so many people are asymptomatic. Testing is lousy, sporadic at best. But this is an important number because the lower this number is, the lower this number of total deaths is. So if you're in a community that's doing a great job following your stay-at-home orders and social distancing and not sneezing on people and washing your hands and not touching your face and all that, um, if only 10% of people get infected here under some of these other wildly speculative assumptions, 135 people would die. Okay, let's make this let's make this 50%. What if 50% of the people became infected? You'd jump up to 675 people dying in this scenario, right? So this next one here is the percentage of people who are infected who show symptoms. This is also a hard one to guess because you don't know what the real number is here, but you may have to just use other communities' experiences to just guess based on who shows symptoms. A good proxy for that might be how many people have been tested, because usually it's people are only getting tested if they're showing symptoms, unless they're wealthy or well connected, and they don't skew the numbers too bad. Here you have the percentage of symptoms that are severe. So how many people show symptoms that are severe? I don't know if this number is right, but what this number is important for is, will you have sufficient personal protective equipment for healthcare workers under this scenario? Under this scenario, if there's going to be 3,000 people showing severe symptoms, you've got to have enough protective gear to handle 3,000 people and enough hospital and healthcare workers and janitors and aides and tech people to handle all of those people. Now, what percent will be uh, requiring hospitalization? That's a big number too. And if you've listened to Andrew Cuomo giving his updates, that's one of the big numbers he's watching, is what is actually the hospitalization rate, because that determines how many beds you need, how much equipment you need, how much staff you need, and so on. So that's a super important number. Um, okay, that's where you break your healthcare system, right? And then what percentage of people will need to go to ICU and need ventilators? This needs to match the number of ventilators and the number of ICU beds and so on. So this tells you what your supply chain has to look like. And you don't necessarily know the wave and pattern of when these people need this, but what we do apparently know is that some people in intensive care stay in intensive care for several weeks. So it's not just, they're not in intensive care a day and then they're gone. It's a huge load to the system. So what percentage of people who go to ICU die? I don't know exactly what that number is supposed to be either, but can the morgues, funeral homes, cemeteries handle this number in your community? If we had 375 people die in a 2 or 3 week period in our little community, that would be very difficult emotionally and every other way. What percentage of non-hospitalized people who show severe symptoms die? Because some people don't show severe symptoms early on, and then their symptoms get much more complicated and they rapidly deteriorate. And some people are just going to die at home because they think they're okay and they're not. So what's that number look like? That number in this scenario here is almost as high as the people who die in ICU. So what does all that mean? I don't know. So, but you can play with this number. How many people get infected? What percentage of those people show symptoms? What percentage of those symptoms are severe? How many people from this group require hospitalization? How many need to go to the hospital and get on ventilators and go to the ICU? What percentage of these people are going to die, and how do you handle that? And then, what percentage of some of the people who weren't severe die? So even under this scenario here, I don't know whether this is particularly optimistic or particularly dire. I can tell you it's particularly difficult for me to say particularly today. So under this scenario, our little community could have 675 people die in the next, I don't know, 3, 6, 9 weeks. That is a lot of people for a small community. And that would take a big toll on us. And everybody would know somebody who died if that many people in town died. So now, just to see what would this same scenario look like in New York City. What are there, 8 million people in New York City? This same scenario here, we end up with 40,000 people needing ICUs and ventilators. Holy free holies. That's not going to work. And we end up with 36,000 people dying in New York City over a 3, 6, 9 week period. That's insane. Even so, I don't know whether I'm estimating high or low here. You go do your research, you figure it out. But I'm telling you, you can use something like this to quickly figure out what do you need to do in your supply chain? How do you staff all this? And then, of course, one of the problems you have here, where if you don't have enough personal protective gear, you're going to start killing your hospital staff. And what percentage of hospital staff is going to die during COVID-19? Is it 1%? Can our society handle that? Is it going to be 10% or higher? What happens? Do we wipe out a whole generation of healthcare workers and it takes us 10 or 15 years to recover our staffing levels for doctors, nurses, janitors, and everybody else in the building? I don't know. You tell me. Anyway, mostly I wanted to do this so you can start thinking about this and do some of your own calculations and think about what the impact's going to be for your small community of your connections and for the larger community that you live in. So anyway, that is my COVID calculator, and I hope that we never get to use this thing, but apparently we will be using it. So if you want a copy of this, send me a message or go build your own. It's not that big a deal. Thanks for tuning in. Stay healthy.